Welcome to Healthier Together, Larimer County's public health podcast, where we come together for healthier lives, connected communities, and real conversations. From your local public health team, I'm your host, Tom.
And I'm Joanna. As the weather warms, many of us will be spending more time outdoors. Whether you're hiking, biking, fishing, or just hanging out in your backyard, it's important to be aware of ticks and the diseases they carry. This week, we're talking with Dr. Chris Roundy, medical entomologist at the Colorado Department of Public Health and Environment, about tick-borne illnesses in Colorado, how to prevent tick bites, and the state's new active tick surveillance program. Chris, thank you so much for joining us.
Happy to be here. Thank you for the invite.
To start, can you tell us a bit about yourself and the work that you do?
Yeah, so I'm the state public health entomologist with the Colorado Department of Public Health and Environment. So in short, that means I support the surveillance and control efforts around the state for mosquitoes, ticks, and fleas. This often involves training on surveillance strategies, mosquito and tick identification, and coordinating vector testing in Colorado. When I'm not hunting mosquitoes and ticks, I enjoy snowboarding, camping, gardening, playing soccer. I'm really excited for the World Cup, and playing Dungeons and Dragons.
So CDPHE has operated a passive tick surveillance program for a while, where Colorado residents can send ticks in when they find them. Can you tell us a little bit more about that passive program?
This tick surveillance program is really a community science program where anyone who finds a tick on themselves or their dogs or in the environment can send it in to us for identification. This helps us identify hotspots around the states, trends from year to year, as well as watching for invasive species. We have really depended on Coloradans for this information. We receive hundreds of ticks every year. These come straight to my desk in envelopes. And to make myself feel better about receiving ticks in the mail, I call it my fan mail. But if anyone has a tick, they can check out our website for submission instructions, and there's a brief survey that they fill out on where they found the tick and some other information.
Do you have any funny or interesting tick-related stories?
So sometimes with those community science submissions, I get little notes that honestly make my day. There are notes from a couple of kids talking about finding this tick after camping or pulling it off of their dad. One individual did send in a haiku about ticks being Rocky Mountain's secrets and hiding in the environment, as well as just little notes appreciating what we do. I've got one that always sticks with me. It says, "Entomologists are awesome, ticks not so much." And yeah, that one in particular really just made my day as I opened up that envelope. Sometimes I get things that aren't ticks, and that's fine. Tick ID can be tough. I'll get things like, spiders, other small bugs. But my favorite submission to this day came in the mail. There was a note card with the tick submission that had a detailed list of all of the hikes that this individual had been on with their dog in the last couple of weeks. I was like, oh, this is great. I never get this much data with a tick submission. I took a look at the tick, and it was actually just a very small rock. This had just become embedded in their dog's hair on a hike. They pulled it out, hard to see, feels like something small, and they'd sent it in thinking that it was a tick, which is all right. I would rather receive something that's not a tick than people, dispose of it.
Yeah, hard to do a pathogen analysis, I imagine, on a rock.
Yeah, hopefully he's not carrying anything.
Have you received ticks from every part of Colorado through that program?
We have received ticks from nearly every county in Colorado. So we've hit the major portions of Colorado. Some of our smaller counties haven't sent many in, but we receive 200 to 300 ticks every year.
So this season, CDPHE introduced a new active tick surveillance program working in partnership with local public health agencies throughout the state. What does that effort look like?
So this effort really builds on that passive surveillance system. Data that we got from people sending in ticks allowed us to justify going out into the environment and more actively looking for ticks around Colorado. Tick collection is often called tick dragging. And really all we do is drag a white cloth through tick habitats. Those ticks think that they've found a nice host, so they grab onto that cloth, and then the light color allows us to spot them easily, pull them off. We then identify them, and we'll also be testing them for pathogens. We are just getting started with this program, but we have been so pleasantly surprised with the support we have received from local public health agencies. We already have about 20 counties participating, which is About as much as we could handle this year. Myself and another medical entomologist at CDPHE, Cassie Durden, had been very busy the last few months going around the state, working with LPHAs and training them on how to collect ticks.
So then you started to talk about this a little bit, but once you've collected the ticks, what are the next steps? What are you looking for?
Yeah, the way this program works is we want collection really to be led at the local level. Local public health groups, as well as people who work in open space, parks and wildlife, academic partners. They're the ones out there doing the work to collect these ticks. They then send them in to us at CDPHE, where I will be identifying them. Once we have them identified, we'll send them off to CDC for testing. CDC will be testing for Colorado tick fever virus, as well as bacterial pathogens like Rocky Mountain spotted fever.
So I am curious, Chris, what kind of ticks do you guys actually find out in the field?
Our two most common ticks here in Colorado are both Dermacenter species. We have Dermacenter variabilis, which is known as the American dog tick. This is primarily going to be along the Front Range and to our east. We also have Dermacenter andersoni, known as the Rocky Mountain wood tick. This tick prefers elevation, so somewhere in the mountains we see a shift to this species, and then it's found west of there as well.
What kind of diseases do those two ticks actually carry?
So those two are our vectors of Colorado tick fever virus as well as Rocky Mountain spotted fever.
Do we see any kind of invasive species here in Colorado for ticks?
We occasionally do get invasive species showing up. It's important to note that these invasive species have not established themselves here in Colorado, but ticks are really good hitchhikers. So when someone travels outside the state, whether they're going somewhere east or south of Colorado, those are where those invasive species are more common. And sometimes they accidentally bring them back with them and find them on themselves, their animals, their clothing after the fact. We get those sent into our surveillance program. And as part of the questionnaire, we ask if someone has traveled recently so that we know if this was found locally or if they accidentally brought it back with them. These invasive species that we're watching closely for are Ixodes scapularis, also known as the black-legged tick or the deer tick, as well as Amblyoma americanum, the Lone Star tick. The deer tick can transmit Lyme disease, which is the most common vector-borne disease in the US. And the Lone Star tick is responsible for causing alpha-gal syndrome, which has been unfortunately becoming more common and has been receiving a lot of attention lately.
Where exactly are you guys finding these ticks? What environment are they most common in?
Places in Colorado with medium to tall grass are primarily going to be the areas where we find these ticks. This can be in open pasture along the Front Range, as well as in more wooded areas along the mountains. Unfortunately, this is where a lot of us like to go out and spend our time hiking on these trails, spending time in our beautiful open spaces in Colorado. But that's where the ticks enjoy hanging out as well.
So how exactly do these ticks spread then?
Yeah, as I mentioned, these ticks are really good hitchhikers. Ticks themselves don't move very far in their lifetime. We're talking a handful of meters of them crawling around. But when they grab onto us or our dogs or on wildlife as well, that's what takes them from place to place. So when we talk about invasive species spreading throughout the US, it's really them hitching a ride on a wildlife and ending up in a new place that's suitable for them.
So what kind of wildlife do they hitch a ride on?
Deer are a really common one in our neck of the woods for ticks to be moved into new places, but they also might hitch a ride on elk, moose, or much smaller animals like rabbits and other rodents.
So wherever those animals are found, you're probably going to find ticks.
Absolutely. Yeah. That's actually one of the things we look for when we're trying to find a good site to collect ticks is wildlife activity.
So when are those ticks most prevalent throughout the year? Is there a certain time where you're going to find more of them?
Tick season typically starts as soon as our weather starts to warm up in the spring. So we start getting ticks, in March or so, and then that high activity will continue through June. As soon as our summers start to really heat up, tick activity drops off quickly. Then a few months later, we see another small bump of activity in the fall once those temperatures start to cool back down. This year was a little bit different. We had a very mild winter and a warm start to spring, so we saw tick activity earlier than usual this year.
What steps can people take to protect themselves from tick-borne diseases?
Thankfully, we can take easy steps to avoid ticks. One of the ways to do that is just to avoid their habitats. Trying to stay on the trail and out of tall brush or grass is a great thing to do. We also want to limit their access to us. Wearing long pants, and if you want to be really fashionable, tucking those into tall socks works really well. And we can also wear insect repellent. A lot of the same repellents that work well for mosquitoes also work for ticks. This includes DEET, permethrin. Personally, I like to treat my clothing with permethrin. There's a formulation that you can use to treat clothing and gear that lasts through several washes, so you don't have to think about it every time you go outside.
And then what about pets? What steps can people take to protect their pets when they're outside?
Similarly, we can try to keep our pets out of those tick habitats. That's not always possible, especially with dogs that like to roam around the trail. So, on our pets as well as on us, we want to make sure that we're doing a good tick check after we've been in these habitats. And both us and our pets, the ticks like to hang out in our crevices, is a great way to put it. Our armpits, the groin area, back of the knee, up in your hair as well. With dogs that are covered in hair, it can be hard to spot these small ticks. We want to be making sure that we check those dogs' armpits, their ears, their groin area as well. Sometimes, if you are brushing a dog or just running your hands along them, you can feel the tick easier than you can see it.
What should you do if you do find a tick on you or someone else?
So, if you find a tick, you want to remove it right away. The longer that tick is attached, the more likely they are to transmit a pathogen if they're infected. And to do that, you'll want to grab a pair of tweezers and grab those tick's mouth parts as close to the skin as you can. You want to pull out straight and steady. Don't twist or yank. That's a good way to accidentally leave the mouth parts embedded in your skin. That doesn't put you at any greater risk for disease, but is irritating, and then it's harder to get out. After you've removed the tick, please send it to me. I really do enjoy getting these ticks in the mail, and it's an important source of data for us.
And then I have to ask for everyone who, like me, at some point has been told that you can use a flame to remove a tick. Is that a recommended or effective method of removing a tick?
We do not recommend using a lighted match or anything else to kind of burn the tick's bum to get them to detach. While that will get them to panic and detach, in that panic, sometimes they regurgitate into the bite wound as they're leaving, which actually can increase your risk of getting exposed to something. Another one that we don't recommend is using Vaseline. People will cover the back of a tick with Vaseline or sometimes even something like duct tape. The way that ticks breathe is through an organ towards the end of their body. So by covering that, you cause them to suffocate. Eventually, that will cause them to pull out, but the same thing with a lighted match to their bum. They'll panic in the meantime, and that increases the possible risk of disease.
If you are bitten by a tick, are there common symptoms that people should look out for?
Both of our common tick-borne diseases here in Colorado tick fever virus and Rocky Mountain spotted fever, start with flu-like symptoms. You're going to feel really tired, have a headache, a fever. From there, Rocky Mountain spotted fever, as the name might suggest, can result in a rash. So if you experience these symptoms following a tick bite or just following being in a tick habitat, you'll want to seek out your primary care physician and follow up with them to get testing and treatment. But for Rocky Mountain spotted fever, once diagnosed, that is very treatable. For Colorado tick fever virus, unfortunately, there is no treatment. That is just supportive care, keeping the fever down, staying hydrated, and resting.
How long after getting bitten by a tick do those symptoms usually show up?
Following a tick bite, those symptoms show up typically within a week, maybe two. So that's the time frame in which people want to watch for those symptoms.
So you mentioned that you like to receive these ticks via mail. More power to you. How can somebody get you a tick via mail if they were to pull one off of themselves or their dog?
So on our website, if you search CDPHE ticks, takes you to our tick-borne diseases page. And from there, there's a link for submit a tick. It'll ask people to fill out a brief survey on where they found the tick, if it was attached, if they have traveled recently. And then the mailing instructions are simple. Just double bag it in Ziploc bags, toss it in an envelope, and get it in the mail to me.
So you mentioned that there is data that you collect about these ticks and some of the pathogens that they might carry. Is this data available to the public?
That is something that we are working on, especially with our new active surveillance program. We're about to have a lot more tick data around Colorado than we have in the past. And I'm working on making that into a interactive dashboard for our website that people can go and see which types of ticks are being found in which counties and environments around the state. That should go live later this year. Great source to learn more about ticks in Colorado is our CDPHE website on tick-borne diseases. That'll cover the types of ticks we have here in Colorado, the types of pathogens that they carry, and where to seek additional information if you're curious.
Well, thank you so much, Chris, for taking the time to meet with us. We really do appreciate it.
Of course, this is great.
This has been really fun.
Yeah, we don't get to talk about haikus and public health very often.
You can find links to learn more about the topics we discussed today in the show notes. If you have a question about public health in Larimer County or a topic you'd like us to discuss, let us know. Email us at healthiertogether@larimer.org. Thanks for listening, Larimer County.
Until next week, stay well, stay connected, and remember, we really are healthier together.